COTU Secretary General says the new NHIF premiums took the union by surprise as it was not consulted.
Kama hatuketi kwa meza tusikizane ni wakina nani watafandi hii scheme, hakuna ndururu hata moja ya mfanyikazi itaondoka. Hakuna.
Atwoli claims that though COTU is an NHIF board member, the union was locked out of talks as its representative was ill at the time the new premiums were passed and later died in February this year.
Paka April yanakuja kutuonyesha, na mimi nikamwambia uiite board, wacha tuite board na general secretaries, kwa ajili iko maswali watakuuliza kwa hii. Akasema ataita kutoka kwa ofisi yangu, anaenda ku gazeti.
The court order stopping the new NHIF deductions is a temporary relief to COTU. It is now crossing its fingers for victory in the new case that it filed at the High Court. But should it lose, the union says it will move ahead to the next option, a strike.
Every worker has the right to go on strike, full stop. Full stop.
The union says workers are unfairly targeted to fund the scheme when the government has failed to honor the Abuja Declaration which it signed that requires governments to allocate 15% of the national budget to health. This financial year, the government only managed to channel 7% of the budget to the health sector.
It is not the responsibility of the worker to fund for the poor of the poorest when the government is not doing it, when the employers are not doing the same, when the MPs themselves are not doing the same. We can't.
Some workers have complained that their salaries have been deducted to effect the new NHIF premiums.
Any employer who might have deducted workers' money, the last marudishi.
The National Union of Teachers (KNUT) is adding its voice to COTU's, saying first there must be reforms at NHIF before the new premiums are effected to ensure transparency.
Even as the idea is good, who is going to manage all these monies?
NHIF has only been footing part of the inpatient bills for its members. However, if the new rates are effected, the new scheme will also finance outpatient medical cover in both accredited private and public health facilities across the country. Those insured will enjoy a string of outpatient services, including family planning, antenatal care, basic dental and optical care, and prescribed physiotherapy, ear, nose and throat services, and male circumcision. It will also pay for dialysis and subsidize the cost of transplants and major surgical operations under the inpatient services. Sylvia Chebet for Sunday Live, Nairobi.